For nearly a quarter century now, the Maine nonprofit Konbit Sante has been helping people in Haiti, the poorest country in the Western Hemisphere. It helps with a sustainable health care system in Cap-Haïtien, the second largest city in the country. And now, Konbit Sante is facing some serious challenges. With us to talk about them, it's Executive Director Perry Newman. Thanks for coming in. Good to have you here.
Pleasure. Yeah.
Let's just talk in a nutshell. What specifically does Konbit Sante do in Haiti?
Well, Konbit Sante works with 4 partner hospitals and clinics to improve healthcare outcomes. We do that not by bringing our own doctors down and telling people how to do things, but by listening to Haitian expertise and providing resources where necessary to improve the system by which healthcare is delivered. So we support training, we support compensation, we support medical equipment and supplies. We help improve the physical space under which care is given. So all of these things together create a system that is able to function better.
And again, the important thing, or an important part of your mission, is that you, as Konbit Sante, are not in the driver's seat. It is the doctors and nurses and administrators in Haiti who are doing the work on the ground, and you are supporting them.
That's correct. You know, our approach is to develop in partnership Haitian solutions for Haitian challenges. We are not an organization that comes down and says, this is how we do things because this is how we do things in the States. Many times the locals have a much better understanding of what works and what doesn't work, and we're there to provide support.
In one of his first actions, President Trump has moved to dismantle the United States Agency for International Development, which provides aid around the world. Okay. This has had a direct impact on Konbit Sante. What has happened?
Well, of the 4 hospitals and clinics with which we work, one of them is supported directly by a grant from USAID. And the loss of that grant is a devastating blow to that community. Konbit Sante continues to operate. Our partnerships with 3 remaining hospitals and clinics are as strong and robust as ever. But now we're in the position of trying to find out how we can serve this community without that funding. It's going to have a devastating blow.
How much money has been lost?
The grant is about $210,000, $220,000 annually, and with that we employ close to 30 people, 8 nurses, administrators, community health workers who care for pregnant women and neonatals, and the critical care that they provide is entirely gone now.
So providing care to thousands of patients?
Many thousands. Vaccinations, vitamins, checkups, community outreach where where our community health workers meet with expectant mothers and determine whether there's a problem pregnancy and can bring them into the hospital rather than having them deliver out in the countryside. People's lives are going to be affected, and sadly people will lose their lives as a result of this decision.
The Trump administration has said that there is corruption in USAID, that money is being ill spent. In this particular case, would you say that the money was being well spent?
Extraordinarily well spent. And I will say that USAID is an extremely effective organ of the government. This particular program is so small in compared to USAID. USAID is roughly a $70 billion budget. Just for comparison purposes, the entire U.S. budget is $6 trillion. We're talking about $200,000 of $70 billion of $6 trillion. So to go after a program like this is not only ill-advised, it won't accomplish the goal that the administration seems to have.
Where do you go from here? What do you expect will happen in the months ahead?
Well, we're trying to piece together partnerships, talent, resources, and so forth to try to at least bring back the service on a truncated basis. If we can deliver the service at roughly half the level, 3/4 of the level on a stopgap basis, then we can serve the people in this community. Hopefully the funding will be restored. If it isn't, we'll continue our search for replacement funding. But right now we can't let the people down. We've got to get it done.
There are, without question, a lot of Americans who would say, we realize that there are needs in other parts of the world, but there are great needs here at home, and that the money that has been spent in other countries should be spent here in the United States. What would you say to that argument?
Well, U.S. aid and foreign development aid in general is an exercise of what we call soft power. General Mattis, whom you may recall from a prior administration, said, if you don't fund the State Department and if you don't fund soft power, you're going to have to buy me more ammunition. Meaning that soft power protects the United States. It enables us to to give the best of the United States to other people in the world who are in need of many, many of the things that we have. And it keeps us safer because it improves our national image. The money that would be saved by cutting USAID is, with all due respect to the amounts of money involved, decimal dust. It's a rounding error compared to what is spent in other aspects of the government. And if the administration wanted to actually do a meaningful review of what programs work and what programs don't, they would have taken the time to do a review rather than just cut it and shut the doors and take the sign down.
All right. We've got to let that be the last word. Perry Newman, Executive Director of Konbit Sante, thanks for coming in. We appreciate you being here. If you would like more information on Konbit Sante, what it does, how it does it, we've got a link on our website. You'll find that in the 207 section on both the website and our News Center Maine app. And we'll be back right after this.